So just wanted to go over quickly. This table provides a quick overview of the Canadian population and its immigrants in comparison in BC and the Greater Vancouver area. Most notably here is that in the Greater Vancouver area, we have more than 2.5 times the percentage of visible minorities as compared to the rest of Canada. So I'm not going to go into a lot of the detail. Basically, 24.5% of BC's population is a visible minority, and it adds up to about 1 million people. From 2001 to 2006, there was 20.6 growth in the visible minority population in BC, and our largest visible minority is the Chinese population. And it's also been predicted that in BC, in 2017, over 50% of Vancouver's population will be a visible minority. And this will have a huge impact on our healthcare system and the services that we provide. This is just a nice visual of the areas where there's a high concentration of immigrants in Vancouver. As you can see, there's certain pockets where there's a large amount, and those are the areas that we focus most of our health services are to for these immigrants. So over the years, our profile of immigrants have changed in BC. We used to receive immigrants from European countries and the States. Now China and India and the Philippines are the three largest sources of immigrants in Vancouver, or BC. So just to give you a bit of information about the organization that I work for, Vancouver Coastal Health is one of 5 BC health authorities. We serve 25% of the BC's population. We have over 22,000 staff, probably about 2,500 physicians, and we have over 5,000 volunteers that work within the system. Daily, we see in our emergency departments about 914 patients, and there's about 1,066 community home visits that the organization provides. We have a budget of $2.8 billion, which is equated to about 3 million patient care days. So Vancouver Coastal Health actually has 3 distinct health service areas in Richmond, Vancouver, and the coastal area. Each of these areas actually have quite a different immigrant population makeup. Richmond has the largest proportion of Chinese in any municipality actually in Canada. And according to Welcome BC, Vancouver is the most popular destination for new immigrants. So this is a very busy slide. I don't expect you to read it. As you can see, it's really, the Vancouver Coastal Health is really a large organization. And one of our organization's strategic framework values, people first, with the vision of promoting wellness and ensuring care for focusing on quality and innovation. One major goal of our organization is to promote better health for our communities, which is the work that I do. I manage a program called the Healthy Living Program, and within that program, one of our key objectives is to reduce the health inequities in the populations we serve through focused improvements in the core public health programs. So David alluded to this also. So this information is probably definitely not new. It's been well publicized that the immigrant populations are healthier when they first come to Canada, and then after 10 or 15 years, their health advantage is no different than the rest of the Canadians. And this is probably linked to many factors such as migration stress, adapting to a new way of life, and immigrants also have difficulties accessing health information and health services, and then there's always the language problem also, and then the determinants of health, which David also alluded to. So when you look at this picture, does our environment actually support healthy living? This is what our new immigrants actually face, and they have easy access to. So, you know, fast food is easier and cheaper than eating in a healthy way. This environment really does not support us in making the healthy choice the easy choice, and that's one of our logos. Our physical environment is one factor that can really determine our health. So as you've heard, health is not dependent just on the individual. It's influenced by many factors. There are some things that prevent people from making healthy choices. And so how healthy we are really is determined, affected by the social determinants of health. And I'm not going to go through those. And the other point I want to make is that some people face greater challenges than others. Not everyone has the same equal access to health information. So just to point out that in BC, 23.4% of immigrants experience low income as compared to the provincial 17.3%. This is quite significant. So 18% of Canadians are below the poverty line, but for recent immigrants, it's about 43%. Poverty continues to be the single most pressing issue for many newcomers. It can be difficult to have health promotion discussions when the client is struggling to meet basic needs. So low-income Canadians actually spend less on food. They eat fewer fruits and vegetables. They're more likely to buy more energy-dense, nutrient-poor foods, leading to obesity. They often run out of food well before their next money is expected to arrive. And low-income individuals tend to live where there are fewer grocery stores, where there's actually higher food costs, and they live near fast food outlets, and they often have limited transportation. One immigrant gave this example of the influences on their dietary habits. Sugar and butter here is so inexpensive, which makes it easy to make sweets. So another individual said that we used to serve fruits to our guests, but not in Canada because it's really cheap to buy sugar, sweets, and pop. So that really leads to the obesity factor. While immigrants in our Vancouver Coastal Health Authority are likely to have never smoked or be daily smokers than the Canadian-born population, they are more likely to be less physically inactive. So barriers that stop them from exercising regular or attending physical activity courses include time and costs. Many newcomers have more than one job, or they're not working, or they're looking after their children or grandchildren, and also because as we heard probably throughout this conference, that they can't afford babysitters. So David also mentioned this. Immigrants are also affected by social exclusion despite their high education level. There's a higher percent of immigrants with higher education levels than the Canadian population. So, and new immigrants are frequently unable to practice their professions due to a variety of regulations and barriers. So their credentials are not often recognized, and social inclusion of recent immigrants has actually been well documented. And all of these factors, again, affect their health and well-being. So again, I'm repeating what David has said. Certain immigrants, because of makeup or their genetic makeup, are increased for chronic disease. And as I've mentioned before, also there's some of their health behavior practices. Not eating enough fruits and vegetables and less physical activity also affects their health. But in Vancouver Coastal Health, probably very similar to Toronto, the identified priorities for immigrants in relation to chronic disease prevention and health promotion are TB, diabetes, cancer, and mental health. So in terms of the higher rate of TB for immigrants, this could be related to their country of origin. They may have been more prone to TB, or they may have had the TB be inactive, and then for some reason when they immigrate to this country it becomes active. So in terms of cancer, one of the reasons that could be because they're not actually aware of the early signs and symptoms, and by the time they actually identify it, it's at later stages, and they also are less likely to look for health services. So the Healthy Living program that I manage within Vancouver Coastal Health actually looks at adult health promotion and chronic disease prevention for an underserved high-risk population between the ages of 34 to 64. The population that we focus on is low-income, new Canadians, Aboriginal peoples, and those who are socially isolated. These groups have historically been underserved within our organization, so it's really nice to know that there is some resources and some funding now to look at this population. Quite often, resources for healthcare are for the elderly or they're very young, not necessarily the middle group. So the key messages of our program is to prevent chronic disease by promoting healthy eating, physical activity, and a tobacco-free lifestyle. So our Healthy Living program provides health promotion at targeted health screening events. We provide screening, 1 or 2 screening events per month. While what is unique about these screening activities is that we have a multidisciplinary team providing these services. We have healthcare professionals that speak different languages, and we can provide culturally sensitive care counseling and screening. Nurses provide testing for random capillary glucose, blood pressure, BMI, waist circumference, and we can also do on-the-spot cholesterol testing. In these events, we also have available for the participants to talk to dietitians, physiotherapists, recreation therapists, and social workers about food, exercise, physical activity, smoking cessation, and stress management. And if we find any abnormal values, these individuals are referred to their family physicians, and if they don't have a family physician, we also provide a list for them to connect with. And we also provide personal information to community resources. So the key to our screening events is that we go to where the people are at. They don't come to us. We actually go out to the community, set up our tables to the places where they actually gather. So far, since about 2007, we've participated in over 50 screening events. We partner with immigrant community groups to provide appropriate health screening at health fairs and special events. These screenings also provide an invaluable opportunity for us to connect with hard-to-reach populations and to hear firsthand what the barriers to good health that they face. Another chronic disease program that we provide is our diabetes education session. We actually provide that in both Cantonese and Mandarin, and we see over 200 clients a year. So we also find that when we're delivering these programs, Cantonese-speaking immigrants are actually welcome this type of education, but we also find that Mandarin-speaking participants don't tend to come, or they're not interested, and we're not exactly sure why. So again, this program is actually quite successful because of the partnerships with agencies like the Canadian Diabetes Association, Success, and the Chinese Medical Society. So in the future, we hope to provide education for the South Asian population around in Punjabi and other ethnic groups as appropriate. So Vancouver has a huge South Asian population. So here's a picture of our nurse and dietitian teaching the diabetes class. I'm not sure if you can see, but in one of the pictures, they have actually a Chinese meal. They're taught to review the blood sugars in relation to the Chinese meal that they've just eaten. So how to engage immigrants in health promotion. We work through our community leaders. We work with community groups. We know that it's challenging to provide the services, and we use a lot of translators. And another part of our program is we actually have some money set aside in our program to provide grant so that immigrant populations can apply, and the grant focuses on the 3 pillars of healthy eating, physical activity, and smoking cessation. So, and those are a list of some of the partners that we actually partner with in our programming. And this is a picture of the recent AMSA fair that we provided health screening for. And as you can see, we have, there's a lot of Chinese people there, and because that's a huge population, and quite often those, our health screening booths are actually quite busy. And another partner that we have is the ICON project, which is the Intercultural Online Health Network, and that's a partnership with a physician group, and they provide forums in the different languages. So barriers that immigrants face are due to unfamiliarity with health system. They have difficulty getting transportations, and quite often they see healthcare professionals as authority figures, and they don't seek services. Many of our services are not culturally appropriate, and they may not include their cultural beliefs, and we still offer way too many programming that is only in English, and we're not as good still with providing different locations for our services. We find that if we're working with the South Asian population, it's better to do the programming where they're at, so we really need to do better and go to the temples to provide those types of services. So some challenges for our healthcare system is that there's just not enough professionals speaking the language. We need to use more foreign-trained staff, and quite often that's not as easy because of the barriers that they face. We actually really need to use more translators. In our program, we actually use provincial translator services, and we need to be more culturally competent in the services that we provide. And again, David's alluded to, we need more print material, and that's translated. And so some recommendations that I want to end up with is providing more culturally competent training and services, and involve more language-specific staff and policy change, and hiring more cultural brokers, which has been quite effective. So in summary, I just want to end off that the healthier our immigrants are, the healthier the Canadian population, and our Vancouver Coastal Health Strategic Plan actually provides that lens of people first. Thank you.